Facelift surgery. How is the surgery completed? Well, today we're looking at animation to show how the procedure is completed. Hello, my name is Dr. Julian De Silva. I am a board certified facial, cosmetic and plastic surgeon based in London. My practice on Harley Street, and I specialize in only facial procedures. The first thing that is done is local anesthetic is used with a small amount of adrenaline, and this is key partly for finding the planes of the anatomy, but also it reduces swelling and bruising after the surgery because some of that adrenaline shrinks down the blood vessels, causes something called vasoconstriction, and ultimately vasoconstriction is what reduces bleeding and hence bruising as a result. So after the local anesthetic has been injected, the next part of the procedure is planning the incisions. Now the incisions are of key importance in facelift surgery because we want to hide the incisions around the natural curves of the ear. And so there are natural curves, and putting the scar right behind the ear can make this very difficult to see, and also curving it under your natural hair can also make the scar really difficult and discreet. In the great majority of people, using multiple layers of stitches, refined techniques, most scars in 98 to 99% of people will heal very well and be discreet. The next part is planning a flap. Now that flap is really used to remove the loose skin. Some people will have 1 or 2 centimeters of loose skin. Some individuals will have as much as 3 or 4 centimeters of loose skin on the right and left side. And it's so important to take away some of this loose skin once everything has been lifted, because otherwise the skin will just sag. There's definitely a degree of genetics to this because particularly if you have hypermobility, your skin tends to be more stretchy and that will tend to give you more loose skin. Some people will have less loose skin and it's more about lifting the anatomy that's dropped. Then the next part is lifting the anatomy beneath the skin. Now this layer in medical jargon is called the SMAS, and the SMAS layer in terms of anatomy is a mixture of fat, fibrous tissue, muscle, but it's a safe area that we can lift, which gives a natural result because it's really this layer that drops down with gravity. Now the old-fashioned techniques were just focused on the skin, but these were not good because this created a windswept look. Then there was an evolution in technique which resulted in the SMAS being lifted, and still much of the surgery in terms of facelift surgery is focused around lifting this area just in front of the ear. I would say that the most modern way of lifting the face to give a more natural result is lifting upwards vertically, and this is termed vertical deep plane facelifting. And although this requires a good understanding of the underlying anatomy, it creates a more natural result because anatomy is being lifted where it has dropped from. So it's a more natural rather than lifting towards the ear where SMAS lifting tends to occur because that's not the natural plane of gravity. Once this area has been lifted, then there is a degree of loose skin. Now the loose skin needs to be removed. So once that loose skin is removed, we can hide those scars around the natural curves of the ears. And key is when the skin is removed, there are multiple layers of stitches because any tension on the remaining skin can lead to widened scars. And in addition to that, we know now that using stitches that are removed after a week, i.e. stitches that do not dissolve, these will give the most discreet scars, because stitches that are left in place to dissolve, in some people they can irritate the skin and they can give more scarring. So I will always use scars that we take out after 1 week, and then beneath the skin there's another 2 layers of stitches that just support everything while everything is healing, because we don't want any tension on scars, because any tension can lead to widening of the scars. Now taking these kind of steps, using stitches that are removed after 1 week, multiple layers of stitches, hiding the scars around the natural curves of the ear and under the hairline, well that will give discrete scars that in the great majority of people are difficult to see. Some doctors will use clips, which in another word for clips would be like staples, and they can be used behind the ear and in the hair. Personally, I don't like to use those because they can create like little track marks. I would rather use stitches that will avoid those things, but they do take longer to put in. So some doctors will use clips in these areas. Other things can also be used to aid healing, particularly around scars, and a more modern approach would be to use techniques such as regenerative medicine, platelet-rich plasma, as these have been shown to aid healing and recovery because essentially it's using your own growth factors to heal the body faster. I do hope this information has been useful for you. Thank you for watching.